Very good.
So we're going to go through a targeted cardiac assessment, but starting off with that initial assessment to start off. Hi Shanann, my name is Matthew. Nice to meet you. I'm a paramedic. What's going on today?
Just it hurts my chest.
Okay, so I can see that Shanann is talking to me full sentences. He answered the question very coherently, and I feel like his level of consciousness is fully intact by how he's interacting with me. His airway is obviously clear because he's talking to me. Breathing, he doesn't seem to be odd. He doesn't have an increased respiratory rate. He may be a little bit dyspneic. Are you feeling a little bit short of breath? No. So no shortness of breath, adequate breathing, and just we'll feel a pulse here and just get a general feel of contour, rate, and normal, strong radial pulse. So you got some chest pain. When did this start? So OPQRST, so onset and origin.
Half an hour ago.
So it started half an hour ago.
Yeah.
Okay, when it started, did it come on just all of a sudden, very quickly, or has it been a few hours coming on?
Well, just over about 5 minutes that gradually increased.
Okay.
Yeah.
Remind me again, I'm sorry, I'm a little bit distracted. How long ago did this start?
Half an hour.
Half an hour, and it came on over 5
Slightly
minutes.
gradually, yeah.
Okay. Have you, and the chest pain, have you ever had anything like this before?
Yeah, yeah.
Okay, what was it the last time you had this?
Well, I've had a heart attack in the past, and I've also had angina pains, and very similar to that.
So it feels like that?
Yeah.
Okay. What do you normally do when you have this chest pain?
I do just 2 sprays of nitro and rest, and it usually goes away.
And usually it goes away?
Yeah, it's been getting a bit longer and longer each time.
Okay.
Yeah.
And today, how is it acted today?
Today's just not going away. It's just getting worse.
Just getting worse.
Yeah.
Okay. So does anything make it better or worse?
Nothing at all.
You probably haven't been up doing laps around the house or anything.
Well,
Have you noticed if you walk at all?
When I went to call you, yeah, I got a lot worse.
A lot worse just with that little bit of just walking over
Yeah.
to get the phone.
Yeah.
Okay. Have you noticed anything like taking a deep breath? Does that make it better?
No, doesn't do anything.
Okay. What about a push on it? Can you point to me where exactly that pain is?
Right here.
Right in the center.
Yeah, yeah.
Okay. And if you push on it, it doesn't
no,
change
yeah,
anything?
I thought maybe I just had pinched something.
And you can kind of been moving and stuff,
and
and
just
nothing.
can't get any relief.
No, it doesn't seem to make any difference.
Anywhere I move, yeah.
Okay. So as far as you relate this to your previous angina, and you've also had an MI or a heart attack before?
Yeah.
Yeah, and this feels very similar?
Very similar.
Very similar. So can you describe that a little bit more? You said it's right here. Is it
Yeah.
dull, or is it?
It's kind of, it's very vague. I can't really...
Heavy, or?
Yeah, it's hard to just put in words.
Not sharp?
No.
Okay.
Yeah.
Does it go up into your shoulders or into your jaw?
Just kind of into my back.
Into your back. Whereabouts in your back does it go?
Just right by, my upper back.
Okay.
Yeah.
Okay.
It's more of like I'm tense or something.
And if you were to rate this pain for me, 10 being the worst chest pain you've ever had, 0 being none.
Absolutely 10. Yeah, it's never been this bad.
Okay. Do you have any allergies?
No.
Okay. What medications are you on?
I'm on metoprolol, aspirin, some Lasix, and
Aspirin, I know.
I have a nitro patch.
A nitro patch.
Yeah.
Metoprolol, ASA, nitro, Lipitor?
Yeah, Lipitor.
There we go.
Yeah.
Okay. So all sound, the metoprolol, was that for high blood pressure, or
Yeah.
did your heart
I do have high blood
elevated?
pressure, but yeah, no, it's for my blood pressure.
For your blood pressure. Okay, and the ASA went on when you had your heart attack?
The first
or before
time,
that?
yeah.
First time? And the nitro patch, how often
Yeah, I usually have it on for the day.
do you have any nitro spray?
I do as well, yeah.
Oh, you do? Okay. Do you take all your medications as prescribed?
I do, yeah.
And you've checked your nitro's not expired or
No,
anything like that?
yeah.
Okay, so no new medications?
No.
No medications recently discontinued?
No.
Okay. As far as your past medical history, any diagnosed neurological conditions like strokes or seizures? No. Any history, any psychiatric history, anxiety, depression?
No.
Anything like
No,
that? Okay. With your, any problems with your lungs?
No,
No?
fine. Yeah.
Okay. And you've never got short of breath before,
No.
experienced shortness of breath?
No.
Okay. As far as your heart, you had a heart attack. How long ago was that heart attack?
10 years.
10 years ago. And how would your angina normally, how often would you have anginal pain?
Just whenever I'm being a little bit extra active.
Okay, so it's very predictable normally?
Yeah, yeah.
Were you doing anything today that, when this chest pain came on? Were you up and about?
I was just
moving
taking out the
things?
garbage, but
Just taking out the
yeah,
garbage?
yeah.
And would you normally get chest pain when you did that?
No, but it's also, I noticed that it's coming on less and with less and less activity.
Okay,
Yeah.
so that has been changing
Yeah.
just in the last couple of weeks, or?
Yeah, about
months?
that, about a
Okay.
couple weeks now.
So, no problem, do you have any history of acid reflux or anything
No.
like that? Okay, just back to your heart, sorry, I just forgot, you don't have any times that your heart races or been told you have any irregular
Not that I know
heartbeats?
of, yeah, no.
No problems with your valves, or anything like
Not that I know of.
No? Okay, onto your belly, so you don't have any acid reflux, any problems with bleeding or vomiting or anything like that?
No.
Okay. How's your appetite been?
It's been fine.
Okay.
Yeah.
No nausea present?
No.
No? Okay. Any, your bowel movements normal?
Mm-hmm.
Okay. No problems urinating, no changes? Okay. Do you have a history of diabetes?
No.
No? Do you have a history of pancreatitis or anything like that?
No.
Okay. So I'm just going to do a quick physical assessment, if that's all right with you, to give you a look over. I'm going to get you to take your glasses off and then shine a light on your eyes. Generally, as I look at my patient right now, as I'm trying to really focus my attention to inspect, do I notice any abnormalities in skin, no rashes, lesions in the face?
A bit pale.
Bit pale,
Sweaty.
bit pale, sweaty. What size are pupils? So just look pupils as is, so they would say 4 millimeters, equal reactance to light. Just kind of flip your eyelids down here, and nice and pink. Okay. Can you just open your mouth and stick out your tongue for me? Okay. Moist mucous membranes. Been drinking lots of fluids.
Enough.
Centralized cyanosis in the lips. Lips are nice and pink. Can I just get you to turn your head to the side and go look at your neck? See any jugular veins? They're at about a 45. Do I see any jugular vein distension? No. No? Okay, you can look straight ahead for me. Do I see any accessory muscle use at all? No scars, rashes, lesions? Okay. I'm just going to push in here for the trachea. We'll just feel your pulses. Okay. Pain in chest, right around your sternum?
Yeah.
Yeah. Any difference? You've already said you can't make it. You can't make it any better or any worse with position or pushing on it. Okay. No rashes, lesions, anything like that. Okay. Take a nice deep breath for me. Okay. Nice symmetry, equal rise and fall. No increased AP diameter that I see. In that pain, if I push on here, no difference whatsoever.
Yeah.
Okay. I'm just gonna have a listen to your lungs. If you can breathe in and out of your mouth, that would be great. Okay, you can just breathe normally. I'm just going to listen to your heart here. Okay. No, any pain down into your abdomen?
No.
Just right here?
Yeah.
Okay, when I push it all, does that bother you at all? Go it here?
No.
No?
That's fine.
What about if I dig around up here? Nothing? Okay, I don't feel any enlarged liver or spleen. No incontinence. I'm just going to come down and look at your feet. Do I see any pedal edema?
No.
Okay, any rashes, lesions, anything out of the normal?
No.
What's skin color look like?
Pale. Sweaty.
Okay. Cap refill?
Yeah. Present.
Present? It's about 2 seconds, which is normal. Just see your hands for a second, just see your fingers, club fingers. Good cap refill. Squeeze my hands for me, right? Feel everything fine? Just going to feel your pulses here. Equal radial pulses, no pulses alternates, kind of regular rate and contour. So now I'm going to just step back, kind of gather my thoughts. I'd probably turn to my piece of paper and start thinking through my differentials, and then have that conversation with my partner, which will allow me to kind of figure out my differentials and see if there's any questions or any physical assessments that I should be doing before I proceed to a working diagnosis and treatment plan. You can hit pause there.